this is Dr. Scott Harrington coming to you live from my doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor from the comfort of your own home from most U.S. states. If you live in Florida, I'm also open for in-person visits in Pinellas Park, Florida on Fridays. Come see me not just as a one-time consultation, but as your primary care doctor, someone who gets to know you, and someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. And if you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, a healthy vegan diet, exercise, and lifestyle changes will always be my first recommendation. My goal is to help you take control of your health. And through the power of a healthy lifestyle, we will work to heal your chronic conditions and help you get off your chronic medications. For my patients who cut out animal products, you will not only be helping yourself feel better, but you will also be doing your part to stop animal suffering and to decrease your impact on the environment. Hey, let's do this. Remember, this content is for educational and entertainment purposes only. This video is not intended to take the place of your own doctor's advice. All right, we are streaming on multiple platforms and ready to take your questions. We have about 9 to 10 people right now in the group. All right, we've got several folks on. Okay, we've got a question from Fernanda Thompson. What do I do if my ferritin level is low? So ferritin is a marker of iron storage. So the concern then is that you have low iron. But really the question should be, are you anemic? Are you anemic? So if you have low iron stores, oftentimes this can mean that you have, you're anemic. Your hemoglobin and hematocrit are low. But if they're not low, having mildly low ferritin is not a real problem. So always try to find the cause. So telling someone that your ferritin is low is not the full story. Usually there is a discussion about your hemoglobin and hematocrit in your blood count. And this will tell you if that's low, you have anemia. And then one of the funny things about a complete blood count is that there's like 20 or 30 different parameters. There's blood size, there's all the white blood cell distributions of all those things. So there's a lot of different clues that you can get out of a complete blood count. And this is something that you go over with your doctor. Commonly, iron deficiency anemia is caused from blood loss. And blood loss can be more of a normal thing, like monthly menstrual blood loss, if you have heavy periods or fibroids causing your periods to be heavy. But then sometimes it can be more insidious or unknown reason, like having colon cancer and losing a little bit of blood every day and having anemia that way. So if the question is always why and what's the cause. So that's important to talk about with your doctor. Sometimes, here we are at Vegan Primary Care. Sometimes doctors are worried, or they'll blame your iron deficiency on the vegan diet or that sort of thing. I wouldn't stop there. I would look for other causes because people can get adequate iron levels through a vegan diet. Greens, beans, and grains are high in iron, and they're easy, they're in forms that the body can tolerate. They don't cause side effects. When you're taking iron, for instance, iron ferrous sulfate, iron supplements, what does it do? It upsets your stomach and it causes you to have darker stool and kind of constipation and thick stool. And so that's no fun. And so trying to get your iron from natural sources is a little better. Honestly, I just put out a Instagram post about, where do you get different iron levels, and it's greens, beans, and grains. So I'll just go to my little profile and pull that up real quickly. For instance, For instance, vegan sources of iron. Okay. The RDA for the recommended daily allowance for iron for someone, for instance, males over 18 is 8.7 milligrams and females over 18 is 14.8 milligrams. Beans, a serving of beans, a half cup, you get 2 to 5 milligrams. A serving of beans, a half cup. Greens, you get 1 to 3. And a serving, a half cup of grains, you get a half to 1.5 milligrams. When you eat iron-rich foods, you want to eat them with vitamin C, foods that are high in vitamin C, so you can also increase the absorption. And that is kind of a good tip. You can also get them from nuts and seeds. You get about 1.5 to 6 milligrams per half cup. And dried fruit comes in at the lowest at 1 to 2 milligrams per half cup. So molasses blackstrap molasses is an iron, it is an iron-rich food. And so people will supplement with teaspoons of molasses if they can tolerate the taste. But all right. So that's what I think of that, Fernanda. Okay. So Kristen, what are my thoughts on vegan keto? Hey, Kristen, how are you doing? Good to see you. Well, I don't recommend a keto diet in general because it's high in fat. And we know that saturated fat's a problem. So in general, keto, you're avoiding carbs. And we know that carbs are your fuel, your basic fuel, your preferred kind of fuel for your body. And so when you're eating carbs, you're not getting a lot of, if you're eating like carbs from natural starch sources like potatoes and beans and corn and, grains and wheat products and stuff like that, you're not getting a lot of fat. And so you can, stay full, you get the calories that you need, and you don't get the baggage of having the fat, and then for the animal products, the cholesterol and all the variety of baggage that you get with that. So now this question may come up because people are wanting to know about ketosis and about fasting and losing weight through fasting. And I am a proponent for fasting. I think fasting is some of the most dramatic health care, health improving techniques that you can use. I've done water fasting myself, but I don't recommend people going on like a staying in ketosis for a long time. It's an acidotic state. It's not, I don't recommend that for health. High fat, low fiber, low carb diets end up causing constipation, heartburn, and a variety of other things that I just don't recommend. Why deal with any of that when you can eat a high carb, low fat diet, still lose weight, eat all you want, stay full without feeling hypoglycemic and having to seesaw back and forth through ketosis and having to restrict yourself from the delicious tasting fruit and the natural food that's easily attainable and safe. So that's what I recommend. Fasting in a supervised state, if you wanted to do water fasting more than 3 days, you want to do a medical supervised fast like they do at True North Health Center in California. They'll monitor you, make sure that you're not getting too dizzy, your sodium is not too low, and that when you come off of your fast, you can do a supervised refeeding. Because the most dangerous part of this is like weird electrolyte imbalances, dizziness, people falling over and hitting their head because of low salt and having low blood pressure, and then the refeeding syndrome that can occur like once you come off. But water fasting is the most powerful thing that you can do, and it's your body's in ketosis, and it's remodeling. It's kind of out with the old, any stuff that you don't need. The body makes decisions. Do we need this tissue or not? And gets rid of it if it's if it remodels you. And so throughout evolutionary history, the assumption is that we would go through these feast and famine states, and that we would be in a fed state and a fasting state But now we are always kind of in the fed state. And so there's health promoting aspects of the fast. But to stay in a ketosis state kind of perpetually, I don't think it's a good thing. All right. Thank you, Kristen. I hope that answers your question. Okay. Let's hear from Kathy McCune Olson. How can restless leg syndrome be treated? Okay. Restless leg syndrome is a situation that at night people their legs will move kind of almost uncontrollably, or you'll feel an urge to move your legs. And it can be very unsettling, and it can keep you up. There is an association with restless leg syndrome and iron deficiency anemia. So we kind of can go back to that, treat the cause. Is there a cause for my restless leg syndrome? Sometimes it's issue of dopamine, and the medicines that treat it are dopamine related medicines. And so you can take medicines to resolve this. Sometimes it is related to having problems with a nerve blockage or a herniated disc affecting the nerves related to your lower body. So first step would be to figure out what might be contributing. So you would want to do some labs. You would potentially want to do some imaging. And if all else fails, you can't figure out why, you correct the iron deficiency anemia, then there are tools, there are medicines that we have out there for this. But of course, as always, we try to avoid medicines if possible. So talk to your doctor, Kathy, and see if that's an issue for you. That's what I would recommend. Okay. Mayanne Harry Shibatsky. Hi, doctor. Is there a test to see if there is bacteria in your gut? Okay. All right, Mayanne. What I think we're talking about here is SIBO, small intestinal bacterial overgrowth. Do I have SIBO? Do I have do I have bacteria that's creeping in from my colon into my intestines, causing me to feel bloated and causing me to have maybe malabsorption or leaky gut or something like this? So I don't recommend going down this road. I don't recommend going down the SIBO road. I don't test or I don't. There is a sugar solution that you take, and then you can do a breath test to see if this is the way it's been tested traditionally, the SIBO diagnosis. But the problem is that when you take a population of people and you test people who have no symptoms and you test people with the symptoms, you get a variety of answers on when they take the test. So the diagnostics is not great. And the treatment that people traditionally do for SIBO is long-term course antibiotics, which is not healthy for you, not good for your microbiome. So when people are worried that they have bacteria in their small intestine, what I recommend is a high fiber diet. What could be causing bacteria to creep from your colon, swimming upstream like the salmon, swimming upstream towards your mouth, when really the food stream is going down? It's a one-way street. It's not usually something backing up this way. That's from constipation and low fiber diet. So you basically, when people are concerned that they're having this kind of problem, I recommend a high fiber diet, a whole food, plant-based diet, low in oil and high in fiber. That gets things moving in that direction, not going on nuclear bomb antibiotics, which can cause other problems. Sometimes people deal with something called C. difficile colitis, a very, very bad problem when people take sort of indiscriminate antibiotics, wiping out your microbiome, wiping out the bacteria in the colon, and a spore-forming bacteria called Clostridium survives and overgrows and can cause colon inflammation so bad that sometimes people get their colons removed. That sounds like alarmist talk, but about 1 out of every 1,000 people who get antibiotics will develop some sort of C. difficile complication, with typical antibiotics you get from, say, sinusitis or for prolonged UTI treatment. So antibiotics are not without their harms. And so back to the SIBO question, the testing is problematic. I don't recommend it. I recommend a high fiber diet. And we have a microbiome, and we want to keep it healthy by eating a high fiber diet. That's what the microbiome wants. It wants to ferment these soluble fibers and insoluble fibers that we consume. And therefore, if we're good to our bacteria, the bacteria will be good to us by creating short chain fatty acids that help to decrease inflammation in the colon. What's interesting is people that have C. difficile colitis, bloody colitis inflamed in their colon, the gold standard of therapy is to give them feces, to do a feces transplant into their colon to overwhelm the Clostridium spore forming, to give them basically a new microbiome. That is now the gold standard therapy for rip-roaring and C. diff colitis. So, Mayanne, that was a long answer, but it brought out a lot of important points for people to know about. So thank you for that. Okay. All right. Tiffany says, can you recommend a good B12? There's so many different kinds. Okay. So the good news about B12 is vegan, and it's created from bacteria. And so you can feel pretty safe about most of the B12 that's out there. I recommend the U.S. Pharmacopoeia USP certification stamp on it, because this is a third-party testing program that tests to make sure there's no heavy metals and lead and that sort of thing, and to make sure that what's on the bottle is on the bottle. And the two most common B12 budget B12 meds that are on the market for that are Nature Made and Kirkland's brand have the USP stamp. Now, not all of their meds are vegan, but this one, B12, is vegan. And so that's why I recommend it. It's a cheap price, Nature Made or Kirkland's. And so I recommend, if you're under 50, 500 micrograms per day. If you're over 50, 1,000 micrograms per day. Dr. Greger recommends 100, and some of the other folks recommend 100 per day. But I worry that, because I forget and this and that I need to take just a tiny bit more. So I'd recommend the 500. Okay. Now, I don't recommend supplements in general, but only take supplements that you can't get from Whole Foods. And this includes B12 and vitamin D. I'm sure you've all heard me say this over and over again. Don't be cavalier. Take the vitamin B. Take the B12. Take the vitamin B12. And I recommend, if we don't want to get, tons of wrinkles and skin cancer, to make sure you're covering yourself with vitamin D3. D3 comes from sheep's wool processing, sheep's wool lanolin. Ugh, who knew? Oh man, that's gross. They put the sheep's wool in a big vat and they boil off the lanolin and they process the lanolin. And so in order to have vegan D3, you have to get it from lichen-based fungal vitamin D3. And unfortunately, the U.S. Pharmacopoeia, the U.S.-based third-party testing none of them are the vegan vitamin D3. So unfortunately, we're kind of on a loss there. You have to go on Amazon and look for vegan D3. There's several versions. And let's see, the one, vitamin B12, the one I've been recommending, there's several versions for D3. Okay, vitamin D3, here we go. Garden of Life, My Kind Organics, has a 2,000 international units for 30 capsules. That's 43 cents a piece. Doctor's Best has a vegan D3 2,500 units, $10 for 60 caps. That's 17 cents. And then Natrello's vitamin D3 2,500, $22 for 180 caps. That's 12 cents. So these are apparently produced in the United States or made or packaged at least in the United States. For children who, if you want vegan gummies or oral spray, searching vegan and made in the USA, the Garden of Life brand has a vitamin D3 spray, and it also has chewable tablets. So that's what I recommend for that. Okay, great question, Tiffany. All right. Cindy Rodriguez says, hey, Doc. Rodriguez Romeo, how's it going? All right. Deanne Yanez says, I have a 17-month who needs ear tubes because medications are not working. And he's not saying a word, and ENT thinks it's because he can't hear due fluid in his ears. Okay, Deanne, is there another resource for this? Well, this is a very, very timely situation. So if you're 17-month-old, it's walk at 1, talk at 2, but there should be some sort of, some sort of like pre vocal. I mean, if there's concern that about the talking and the vocalization, and mimicking behaviors, it's not working out, and there's concerns about hearing, the number one thing you would want to check is the ears. And I think it's reasonable to trust this ENT. If you want, you can get a second opinion, but I would, if that is the primary treatment, that's what I would recommend. You can maybe even talk to a speech therapist, a speech pathologist type person, and see what they think. But that is a reasonable treatment. The good thing about this type of therapy, it's overall, it's kind of less invasive than most procedures, I guess you could say. And eventually the ear tubes come out and the eardrum heals back up. A lot of times, sometimes doctors will look in the ears, and if you've had ear tubes, and they may not even be able to tell because the ear tube came out and it's sealed up and you wouldn't know the difference. So I think that is a reasonable approach if that's their concern. And they're the expert on that. So I would trust them. Okay, Jacqueline Rose Ramondo says, thank you all. Vegan primary care, appreciate it. Okay. All right, so we've got Man says, thank you so much for your advice. This is a test my doctor suggested. I'm eating high fiber, but still have issues, so I'll give it more time. Okay. Yep, talk to your doctor. I try to avoid expensive tests if you can avoid it. Some of the things that people concern about SIBO, or they're worried about SIBO, is that they're eating a vegan diet, but they're dealing with lots of gas and bloating and this sort of thing. And my approach to this is, take it low and slow. If you eat like a ton of cruciferous vegetables, they can be really gas forming. And I'm generally not a all or nothing kind of guy. Like, stop cruciferous. No, don't stop cruciferous. It's amazing. It's got sulforaphane, cancer fighting properties. It's got lots of fiber, and it's packed with nutrition. So if cruciferous causes you to feel bloated and gassy, and you just kind of decrease the dose, or you can cook it, cook it. So cruciferous includes kale, bok choy, broccoli, cauliflower, that kind of thing, Brussels sprouts, cabbage. You can cook it, and it can decrease the symptoms that you get from the cruciferous. If you're eating beans, be careful to rinse the beans. If you get them from a can, rinse. Don't eat the aquafaba. Because that'll be way more gas producing and that sort of thing. If you have, and then there's issues with gluten and stuff. 1% to 2% can have a celiac or gluten intolerance and sensitivity. So there's that. There are a few things that you can kind of look at as opposed to getting the diagnosis of SIBO and taking hardcore antibiotics, which I kind of think is a misguided approach. Okay, let's see. Thank you, Mayanne. Okay, so Joey Drucker says, can ulcerative colitis be cured with a whole food plant-based diet? Whole food plant-based diet. There is great evidence, Joey, about the whole food plant-based diet in the treatment of ulcerative colitis. A lot of it is coming out of Japan, the studies. So one of the big keys is avoiding eggs and the sulfuric acid byproducts from the egg amino acid breakdown, potentially causing irritation to the wall of the gut, and just straight up interactions with the variety of animal products that recreate unfavorable environment for the lining of the colon. So yes, cure is a strong word, but I'm here to tell you that that the plant-based diet is the best possible scenario for someone with ulcerative colitis. I'm going to have to give shout out to another YouTube channel, High Carb Health. High Carb Health is someone who went through hideous ulcerative colitis and went on a plant-based diet and documents his process and shows you the pictures of his, colon before and after, and this kind of thing. So yes, when you have a ulcerative colitis flare, you want to go on a sweet potato and squash soup type diet, and with the immersion blender, you blend it down into a very baby food type consistency, so that it's the fibers are kind of pre-digested, and it's when you have ulcers on your colon, you can't handle a ton of fiber, and so you're doing this. You're doing warm rice congee, which is watery rice with a tiny bit of salt or some mushroom flavoring, and juices, because it's low in fiber, and it will help you have those ulcers heal. Just like an ulcer on your skin, you can imagine you wouldn't want stuff like really rubbing past it, and this you want very soft stool, fibrous and watery stool, until those ulcers heal, and then you can go on a slowly include more and more different foods, and then you can find things that really will cause flares. So when you have ulcerative colitis, it can be very dangerous, and you have to be treated. You have to be seen by a doctor and this sort of thing. But the nutritional aspect is with a whole food plant-based diet, starting with these recipes of low fiber, pre-digested type foods that are known not to cause irritation to the colon. So yes, Joey, absolutely. Okay, Tiffany says, thank you. You're welcome. Deanne says, I asked a question. Okay. Okay. Tanya says, how can a person regain scent and taste once they are gone? Could this be due to COVID if there are no other symptoms? And how long can a person be contagious in this case? Okay, Tanya. Well, I guess that if your question is about COVID, 10 days after the onset of symptoms, most people are no longer contagious. You can test for yourself to see at that time if you're still positive, you would be worried that you could potentially be contagious. In terms of the smell and taste, this is a nationwide epidemic of people having problems with this related to the COVID virus, and there's no great answer. You're kind of just hoping that the body will help heal and kick in over time. And I recommend the whole food plant-based diet as the best bet for the baseline of health. But I don't have necessarily evidence to say that this would be the thing that would kick it back in. You're just kind of waiting and seeing. There are papers that suggest that people on a plant-based diet have lower severity of symptoms, but they still get COVID. So plant-based diet is very good in helping you decrease your severity, decreasing risk factors for severe infection like diabetes, obesity, high blood pressure. But so people are still getting it at a similar rate, but plant-based folks, vegan folks are not having the severity as seen in other diet types, omnivores. So hopefully that helps. Okay. All right. Okay, so we're running a little bit over here, but I'll go forward. Pam Hontham. Hello, Pam. How's it going? My son had his ears drained and avoided tubes, but I'm not sure if they do that anymore. My daughter had the problem too, but they did allergy tests to find that that was causing the fluid. Once identified the cause, she was good. This is a great answer, Pamela. And, we may need you to be a guest on this show. So yeah, great answer. So back in the day, doctors would take needles and they would poke it into the eardrum and draw out fluid. That's not standard practice anymore, like you were saying, but finding the cause of a child having maybe allergies causing this kind of thing. Typically, what's happened is frequent infections. Now, what can help prevent frequent ear infections? Breastfeeding smaller infants is a protective factor. And of course, I recommend avoiding dairy, animal, cow, dairy as an anecdotal risk factor for this kind of thing, and mucus and allergy type symptoms. So, okay. So yes, so Deanne's suggesting that this is from infections. That's a chronic otitis media, chronic infection. All right. Okay, we might end it with this. Dr. Scott, I'm coming up for the need for annual doctor visit, blood tests, and blood work. What is your process for first-time patients? I'm local. Okay. Yeah. People just go on my website. They book an appointment if they want to be seen in person or live in Pinellas Park. You have both choices. For our first visit, I like to see people for an hour so we can sit down and really get to know each other. And so that's the beauty of my practice. I really enjoy that. And so if people want to get the labs done before or after, you just in the booking appointment, you just let me know that you'd like to have labs done either before, or we'll talk about which ones you want at the visit. And we do it through LabCorp or Quest. I get you set up with an electronic medical record that you have, your portal, and we can communicate securely back and forth with that. I get you an order. You take it to LabCorp or Quest, and it's done automatically. They scan the paper, the order, and it just gets done all automatically. Paid for by your insurance, or I have a client pay system where patients can get cheap labs if they don't have insurance, a very, very inexpensive price through Quest. And this is through my account. Quest gives me a price, and I turn around and give the patients the same price. There's no upcharge for that. So I think that is a good stopping point. So I want everyone to take control of your health this week. Stay on the plant-based diet. Don't get off the path. Don't get off the path because it just makes you feel good. It makes you feel good for so many reasons. So, hey, until next time, I'll be back next week after they had a small hiatus here for over the last couple of weeks, but I am back. So go ahead, you guys. Go vegan. See you next time.